Welcome to the Seniors Flourish podcast, where it's all about helping occupational therapy practitioners working with older adults be the best they can be. And now your host, Mandy Chamberlain.
Hi everyone. Before we get started, I wanted to talk about Seniors Flourish's sponsor, Great Seminars and Books. What I really like is that their mission is focusing on geriatric rehabilitation education and training for clinicians, which, as you know, is near and dear to my heart. They have great live courses focusing on topics such as clinical orthopedics, cancer rehab, or even topics such as clinical neurology. There is a course for anyone looking for evidence-based practice and treatment ideas while working with the older adult population. These are definitely some topics that I am interested in, and I think you should check them out too. So head on over to seniorrehabproject.com/great and use my promo code SRP25 to get $25 off your next course. Welcome everyone to the Seniors Flourish podcast. My name is Mandy Chamberlain. I am the occupational therapist and the host of this show. And today I'm super excited, which I think I'm probably excited about all my guests that are on here. But today I'm talking with Carole Lewis. She's a physical therapist and geriatric extraordinaire. That's how I'm going to introduce you, Carole.
Oh my, I love that.
I know. We're going to be talking about health promotion and exercise in older adults. So it's kind of a topic that's near and dear to my heart because I really am an advocate for prevention, and especially when we're talking about older adults, which is my little love. So, hi, Carole. How are you today?
Good. I'm doing great. It's rainy here, but talking to you brings out, makes it much better. So thank you.
Oh,
this will be fun.
Thanks, Carole. As most of the listeners know, the Seniors Flourish podcast is actually part of the Senior Rehab Project, which is a podcast network, and who is in charge of that is, his name is Dustin Jones. He's a physical therapist. But I was talking to him about you, Carole, and this is how he described you as. He was like, you have Mount Rushmore. If you had like all the faces of geriatric physical therapists on Mount Rushmore, Carole Lewis would be on it. Now that is
well, thank you.
I know.
Mount Rushmore. I've never heard that analogy, but I love it.
I think you should use it because I think that's
definitely.
Isn't that hilarious?
Thank you. That's very fun. A little embarrassing, but very fun.
I know. He is really, really funny. But anyway, so I just kind of wanted to talk about your physical therapy journey, how you got working with the geriatric population. I mean, I know you have a huge history of, physical therapy, your own physical therapy journey, but how did you get to where you are today?
Okay. Well, gosh, I don't know how far back you want to go, but I won't go that far. Let's start when I was a physical therapist right out of school. And my very first job was at a gigantic county hospital in Los Angeles. And 1 year into working there, I started really, really enjoying working with older persons. I was on the orthopedic. We did rotations, orthopedics, and we went to the medical floors, and then we did a neuro rotation. You had to go through all these different rotations for several months. And I started really enjoying working with the older patients. So when it came time to divide up who was going to see who that day, I would get the older patients. And then I thought, well, what's out there for older patients? And at this point, geriatric medicine was just starting, and there was no such thing as geriatric physical therapy. It didn't exist. And so I thought, wow, I would like to get better at this because I think it's worthwhile. And there was a program of gerontology in the same city I was in. It was in Los Angeles. So the USC, it's called the Andrus Center for Gerontology, the Leonard Davis School. And I applied, and I was in the second class to ever begin. And this was one of the first programs where everybody was saying, oh my gosh, why do something in gerontology, geriatrics, if there's no future? And it was a program that was everybody, social workers, PTs, OTs, psychologists, biologists. So all of us were going together to get our master's degree. And it was one of the first master's degree. The only other one I think in the country that started at the same time was Duke. And so we were one of the first. to be out there. And so I took that and applied it to the field of physical therapy. And it was it was wonderful. I really loved it. So that was great. And from there, I decided to write a book on geriatrics, which I believe was one of the first textbooks. It was one that was multidisciplinary. So it was for physical and occupational therapists. And it was called Aging Healthcare Challenge. And it came out in the 1980s. So it was one of the first. So I followed it from there. I ended up speaking all over the country in the area of geriatrics. My first class was in Flint, Michigan, with 5 slides. It was a full day class and 6 people. And then I ended in New York City with 150 people. So there was definitely an interest in people learning about geriatrics. And I've just continued to work in that area. My clinics saw people of all ages, but my area was geriatrics. So my schedule was just the older person. Okay. So I love it. I think it's a great area for people to go into because I think there's so much to learn and it's so complex and it's exciting, because it is. It's not easy stuff. To be in this field, you got to be on your toes constantly.
Yeah. There's such a lot of them have such medical histories, and it's not just so cut and dry. Like if you're talking about just a basic orthopedic patient or something like that, there's just so much to the patients. And that's actually one of the reasons why I really like it. In addition to just working with them, like personally, I think that's really fun. But if you really look at the medical history of it, you'll have so many, dual multi-diagnoses that you need to make sure that you are looking at to get the whole picture. So it's just kind of I think a challenging / fun population to work with. So
yeah, I love that you say that because that's my reason. A lot of people say they like to hear people's stories and the people are appreciative, and those are good reasons. But you're one of the few people that have said that it's a challenge and you like the challenge. Yeah.
I do like the challenge. It's, people, I think, like you said, were saying, it's one of those things that people, I think, I shouldn't say disregard, but just kind of underestimate the complexity of working with older adults. It's not so black and white. So it's fun and they're fun. So it makes it fun.
I agree.
So, so basically I wanted to kind of talk about health promotion, which is, I know, an area that you are also passionate about. And, I just kind of want to talk about a little bit about how we can, as an interdisciplinary team, and how can we work together to provide that quality of care for an older adult in community, or how do we do that? How can we do that? I think it's sometimes a little overwhelming of a subject.
Yeah. It's been around for a while. And I'm a little disappointed in both of our professions for not taking more of a lead. We really have the tools to be outstanding leaders in this area, and we really haven't done much. I really do think the AOTA, the APTA should get together and make a real stand, like the American Medical Association and the Academy of Sports Medicine did with that exercise is medicine, the EIM, that came out in 2008. They said exercise is medicine, which is great, but something like that should have come from us. I think sometimes we don't own exercise. We say, we do function, we do this, but we are exercise experts. We know in particular how to take exercise and make it into something that's going to improve your life. Whereas I think when I see other people leading exercise programs, they're just trying to build their body or look good, which is fine. But I do think that there's a huge percentage of people that want to exercise to feel better, to perform better, not just in a sports necessarily, but, to perform better getting out of a chair, or walking to the grocery store. And I think that's a huge piece that's just not being addressed. And who better than OT and PT to address that? So I think that's number one, is we need to really recognize that we are exercise experts and we should be really overseeing. I mean, if somebody comes in, and here's my goal of all goals, that you go to see a PT or an OT every year like you would go to see a dentist. You know, the dentists have sold it. There's nobody that would even think of skipping their dental visit. You know, I think it should be the same thing, that you're going to see an OT or PT every year. Your doctor is, you know, going to order a test that measures your functional level, and that they get that. You know, I mean, if you look at the EIM, it says the doctor should assess the person's, quote, functional level, and guess how long they give them to do this? 30 seconds. 30 seconds. In the I mean, come on. You know, what are they going to do in 30 seconds other than write an order for them to be seen and evaluated by a therapist? I mean, that's what they should do. And so that's where I think we need to be. I mean, it doesn't have to be this. This is sort of my vision. I'm sure there's a lot of other things we can do, classes, instruction. You know, we really should be out there to the community. And I had a horrible thing happen, a couple months ago. I got this notice to go see this program called Better Body. And I thought, maybe it's, you know, something to put, you know, get you looking great. So I thought, okay, I have a free hour. So I ran over at lunchtime, and there was a woman who was an exercise phys person, and she was giving a talk pretty much on aging. And she was giving out relatively false information. And, you know, when and all the participants were over 65, most of them were in their 80s. And one lady raised her hand at the end. You're going to love this one. And she said, why should someone get a total knee replacement? And, you know, what's the reasons for that? She goes, people get total knee replacements because they fractured their kneecap.
Oh my God.
That was her answer. And then she proceeded to answer many other questions incorrectly. So you know, we should be out there. The OTs, the PTs should be out there talking about aging, you know, and what we know and what we can do, and getting people interested. And then, you know, it needs to be like that on all levels. You know, I do presentations at skilled nursing facilities, at community centers. I do classes, you know, where I'll have my new one that I love is I team a healthcare provider, so a nurse or a nursing assistant, up with one of the residents, and they exercise as a team. So I do a high level, for example, balance activity with the nurse, and a lower level one for the person who's in the wheelchair, and we do them together for an hour. You know, so it's kind of fun. I mean, but you know, you can be done by a therapist. We don't have to give it away to somebody else.
Oh, absolutely. Absolutely. You know, and I think that's the hard thing. Like, and you do that, I'm assuming, through your clinic, Carole? I mean,
you can go to any place and just, you know, say, hey, you know, no, I don't necessarily do that through the clinic. Okay. You know, I that's sort of my own, I do screening.
Your thing.
And actually you have to be a little careful when you do a screening in that you can't refer them directly to you, because there's some kind of legal thing that that's not good, but you can refer them to a list of other people. So you can be on the list, but you can't say, oh my gosh, I found this wrong and you need to come see me. Because that's, I think, illegal. And I don't do that. What I'll do is say, you need to see a therapist. And what I try to do is, if I'm doing it in different parts of the city, I get a list of the therapists. I try to go meet them all. I'm not successful in that in every area, but I try to meet them so I can hope that they go to a good practitioner.
I know prevention is obviously a big deal. And I think what the challenge is, of course, like, especially if you're working in a quote typical clinic, it's like, you know, convincing your employers that that is part of your job to go out there. You know, your job isn't just to see the patients, but if we want to be promoting health to our communities, we either need to do it on our own or, you know, convince our employers that this should be part of the realm of, OTPT, and that we are promoting health to other, to the community. And it's really hard. I think, because I've had people say to me, like, that's something they'd love to do, like do some exercise programming for older adults or, like health promotion things, like you said, and do some talks and things like that. But it's like, they have full-time jobs and they're like, I just wish my employer would. You know what I mean? Like, let us do that and get out there.
Yeah. And I think that's going to become an easier sell. I did a consult with a relatively large company that has private practices to set this up for them. And we came up with a screening tool, and they go into community centers. And what they find is when they do the screening, that converts to a large number of new patients. I also know a therapist who just the other day was telling me he did a presentation on a screen that he's willing to do in his office. And he did just a presentation we have these things in DC called villages. You have those where you are? And these are a community, and everybody should check those to see if they have villages, because they're spreading pretty quickly. It's a whole network to help people stay in their homes. So these are people who want to find services so that they don't have to move into a skilled nursing facility or an ALF. And they're looking for presentations. So he just presented to one of those villages, and he said, there were 30 people that came to the talk, and he got 10 of them called and said, I want the screen. And he's charging $100 for the screen. From that, I haven't talked to him yet. That was only a week ago. I'm sure he's going to get a few of those that convert to becoming patients.
And it makes it worth
and
it.
I personally, I'd much rather spend the money on, the PT or OT than on a surgery that they don't need or they could do without. And there's so many things that we've got to be aware of. I mean, gosh, I just read a study about how a treatment technique for carpal tunnel was better than carpal tunnel surgery. I mean, how many orthopods, will tell you, you got to have carpal tunnel surgery. Well, if you don't hear of any other options, you're going to do it. But, here is one that was complete hands-on, exercise and soft tissue work that got as good a result. I didn't say it was better, but as good in three visits.
Well, and these are the things
and then there was one that came out that. Go ahead.
I'm sorry. No, I was going to say that's why, evidence-based practice in journals and research is so important, because then we can do best practice and we can, justify what we're doing, why we're doing it. And it's just so important. And it's hard because, the consumer in general doesn't necessarily know that. So that's part of our job.
Right. Definitely. And you know what? And unfortunately, we don't have the big bucks either. We don't have drug companies that are going to pay for expensive commercial little drive patients into your practices, and we don't have big monies like the hospitals have to get people for surgery. So it really takes us beating the bushes and screaming that, hey, we're out there. We provide a great service. You got to, learn about us. So I love that.
Yeah, definitely. So if you were going to start a program at a facility as a health promotion or an exercise program, what would be kind of the steps that you would recommend someone where would they start?
Well, the number one thing that I want to stress to anybody is make sure it's evidence-based. All right. And it's easy to go out there and say, okay, I'm going to start an exercise class, but see if there's already something out there. And this is a little self-sell, but let me tell you what I have, because I feel so strongly, and I've been doing this for years. We came up with, and it's free. It's the Moving Target Screen, and if you go to movingtargetscreen.com, you can download a form for free. It gives you 15 evidence-based tests that you can use that look at strength and balance and posture, flexibility and endurance. Quick tests that you can do. And if you're good and the people are high level, you can do it in 30 minutes. If they're lower level, obviously it's going to take longer, but and you can vary it depending on your population. But I think it's one of those tests that has, good reliability and validity and predictive analytics that any therapist could use, at least to get started. And then, so do that. And then with it, we also came up with exercises that are evidence-based, that will work on posture, that will work on flexibility, strength, and make sure that what you're doing is evidence-based. There's lots of books out there on how to design classes. I've written a few, but there's, here's a perfect one. Dr. Marilyn Moffitt and I did a book called Defying Fitness, and we published it. It was number 4 on Amazon for about a minute. For a whole minute. But the one thing, we wrote it because no PTs or OTs really write exercise books. They're all written by exercise physiologists or movie stars. And we thought, we need something written by a therapist. So we wrote that, and that has some good ideas for exercise classes and screening tools that therapists could use. So, get something that's evidence-based. And so if you want to get started, first of all, search for what it is you want to do. Do you want to lead a class? Do you want to do a screening? Do you want to go to a corporation and give advice? I mean, I've gone in DC. We have so many lawyers, but what I'll do is go to law firms, and employers have to provide health type education for their employees. So one of the things that I've done is gone at lunchtime and provided talks on fitness or optimal aging or whatever you want to call it. And, just put together a PowerPoint if you want to do something like that, which, and go out there and talk to people about what you know, and you'd be surprised. Even something as small as posture. Oh my gosh. People in their 40s, 50s, 60s are starting to notice their posture doesn't look so great. And they want to know what they can do. And, there's great literature out there on it, on what you can do, how to assess it. And, just even a half-hour talk on that and have people self-evaluate their posture would be really fun. And then say to them, here's some things you got to do. You could probably, people could get fractured ribs from that. Vertebrae from that. And so, and it affects falls. It affects, if you look at, is it Cato's study or Ryan? It might be Ryan. Did a study that showed that hyperkyphosis in a forward head affects almost every ADL, toileting, out of bed, dressing, so here we are working on those ADLs. We haven't even looked at posture, and we know it affects it. So here's some great ways to help people before they can't dress. When they're 50s, 60s, sitting at their desk all day when they shouldn't be, and getting them up, they just seem to be so many things that we can do. And I encourage people to try, and you're going to have trouble. No one's going to say, oh, yay, we were waiting for you. So that's the hardest part because we're used to that. We go into a patient's room and they're going to see us. They're not going to go, I don't want, that happens rarely. So, you go to the human relations or human resources person at an office, and you write them a letter, you send them an email, you give them a call. You got to give them they say it takes 7 times for someone to even notice that you're there. So don't give up after you're 7. Don't give up. Keep going back, and it's hard because it's a little tough on your ego, but go out there. And that's how you do it. You just, hang up your shingle and start doing some of that.
Yeah. It's just getting out there. We have, at one of the facilities I work at, we have a balance program for the community, and it's really good because then we finally got the doctors on board. It's those people that aren't quite sure that they want to go to quote, PT or OT, and they're like, but it's, the doctor, when you hit the doctors on board, they're the ones that can convince them. They'll be like, okay, it's social, it's, X amount of times a week. And it's like and they love it. It's just like convincing them. Not only do they think it's important, but like, when you have that doctor backing you, that just gives that little extra edge. And it's just been amazing for the community, unlike just a community building, like a social kind of a network. And also it's like, obviously we're promoting health promotion, exercise, balance, preventing falls, keeping people independent. We're doing all the things so it's just been really, I don't run it, but I've been to it, and it's just fun. It's fun. And it's really neat that the facility is on board, because it's like you said, he's talking to the HR, talking to all the people that are quote in charge, and convincing them that this is good for not only you're providing a service to the community, but you're also promoting your own business. And so in the long run, you end up getting more referrals, and it just kind of, it works. It serves both purposes. And so
I think it's great. I love what you're saying. And, you can even do the screen for the doctor. Drug reps always come in and they bring lunch, and they'll take the doctor and his staff, which I've done so many of these. And just say, hey, I want to bring in lunch, and I want to show you this screening tool I'm using, this moving target, or I want to show you a balance class I'm doing in the community, and as long as you give them some education, you can go in there, bring them lunch, or if you don't want to do that, you don't have to do that. But usually it's a great way to get some rapport with the staff, with the physician, and to let them know what you're doing. And, I think we're also tied into getting insurance reimbursement, which is great. But the preventive realm, there are a lot of people that are willing to pay to get the appropriate exercises and prescription for what they should be doing. And I think it's a very untouched population. And because we're not doing it, personal trainers have just rushed in there, and taken over, and we're letting them do it because we're not doing it.
Yeah. I mean, obviously we have such a unique and distinct value for that. I mean, we're the ones that know how to, personalize it a little bit for each person. I mean, there's so many things that we can do for it, but yeah, it's like you go sometimes and you're like, oh, personal trainers and, it's tricky. It's tricky, I guess is the right word. So we need to take that back. We need to take that back and be, the health promoters for the older adult, especially, I think specifically in the community. So it's just, it's just another avenue.
No, I agree with you. I agree with you. So I'm thinking we've given your listeners some ideas. Yeah.
Yeah. I think there's lots of little gems in there and lots of ways to kind of, get them out there. And I guess thinking outside the box, because it's something, if you're passionate about it, those are the things that you can make it happen. I mean, it's just doing it. But I mean, I know like you did, Carole, you run great seminars, and I saw that on there that you have a home study course called health promotion exercise for older adults, kind of help OTs and PTs kind of, I guess, navigate some of those things.
Yeah, it is a course. It's based on my book that has 50 different classes in it. It shows you how to go in there and, negotiate a contract, what kind of music, is out there that older people might like to listen to if they're going to do an exercise class, and how to calculate what a fee might be that would be reasonable. I mean, I've been doing classes since graduate school, and I realized in 2 afternoons, even charging just $5 a person, I was walking away with several $100s, an afternoon, because if you get 20 people in your class, you're making money, and $5 for a person to take a class is reasonable to them.
Right.
So there are ways to figure out a way to make it work for everybody. So that's what that book is about. I'm glad you looked at the site. And I think, I think there are lots of opportunities. Just, like I said, make sure if you design your own to really go to the literature and see what there is, and when I mean literature, it's not so much a book as go to the original sources. So for example, let's say you wanted to come up with, what is a great treatment for hyperkyphosis. My favorite, bar none, is Bautman's article, Bautmans, and it's online. The whole thing's there. It's an incredible protocol. It's very easy for a therapist to do. Not so easy if a layperson read it or a exercise phys, but a PT or an OT would know exactly what to do. And you could use that on a one-on-one approach. You could do it for a preventive approach, health promotion approach. But wow, just starting right there with an evidence-based article versus saying, okay, you should pretend there's a silver thread on your head and lengthen. That's nice, but there's no evidence that shows that works. Versus Bautman's protocol that has these very specific exercises and even includes a couple taping techniques with kinesio tape is very cool, and it's somewhat hands-on, but it's also a very prescribed program that helps somebody progress. And I've used it on so many people, and they come back saying, "Oh my gosh, my posture is so much better." And, like I said, posture is important. It's one of the pieces of the puzzle. But, we have lots of areas to work on with our older persons. And so, I think they're receptive. I think they're willing to learn these techniques from somebody who really knows what they're doing. And that's us.
Yep. Absolutely. Yes, I agree. Well, just kind of wrapping up, Carole, I just wanted to really just thank you for kind of just motivating and getting everyone excited about health promotion and like, giving them little gems on some kind of ways and ideas to kind of get out there and like be an advocate for, OT, PT, and, help our older adults in our communities. And so I really appreciate you.
Well, can I thank you though? Can I thank you?
Yeah.
Because I've listened to some of your podcasts, and I really love that you use good information, and you seem to really get to the heart of some of the issues. And I it's so important, and I hope that a lot of OTs and PTs will listen to what you have to say, because I've heard some really great pieces of information from your podcast. So I thank you for doing what you do. It's great.
Oh, thanks, Carole. Yeah, I part of my goal is to like make sure that we are, having fun, because like it should be fun. Therapy should be fun.
Yeah.
And, and using the evidence, and then also really just making sure that the things that we're talking about is actionable, and that it gets people thinking and excited about being a therapist, and it just stirring up that excitement again. So I appreciate you being here, and I will put all those references, because Carole is a woman of wonderful information. I love it. And I'm going to put those in the show notes. And I thank everyone for listening today. And I look forward to talking with you again soon.
Hi guys, don't forget to check out the live courses from my sponsor, Great Seminars and Books. I love the variety of courses they offer, specifically because they are relevant to the populations that we are working with every day, older adults. And their topics include things such as home health, a specialty course of its own, and clinical implications of pharmacology for the therapist working with the older adult. So all these topics are relevant, evidence-based, and very practical. These are treatments that you can learn in the course and take back and use right away. So head on over to seniorrehabproject.com/great and use my promo code SRP25 so you can get $25 off your next live course.
This podcast is brought to you in partnership with the Senior Rehab Project at seniorrehabproject.com.